Hello and welcome to the Justice Factor. The South African government plans to extend HIV/AIDS testing to the entire population and speed up ARV treatment for those who test positive for the virus. As it's World AIDS Day, we take a look at the state of South Africa's health services and reflect on the fight against HIV infection and AIDS. My guest today is Minister of Health, Dr. Aaron Motsoaledi. We'll also have a regular feature, the winner of the week, and our 3 big losers of the week. But first, we speak to Dr. Aaron Motsoaledi. Dr. Motsoaledi, welcome to the show.
Thank you, Justice.
South Africa has had a long battle against HIV and AIDS, lots of controversies. You came in 2009, a new vision, a new resolve to fight against infection and so forth. How are we doing 5.5 years later?
Well, we're doing well, only that there's still a long way to the end. But I could say, yes, we can see the winning post is inside. I'm saying so, Justice, because we have just been checking recently. If you go to State South Africa, it will show you that the death rate has now decreased by 21%. We no longer have as many people as dying as that. We also look at the mother-to-child transmission. If you go back just 10 years ago, there used to be 70,000 babies in South Africa born HIV positive every year. Now the figure is down to 7,000.
That is
because of mother-to-child transmission, absolutely. So those type of things give us courage that we head in some way.
One of your aims is to eradicate HIV transmission totally by 2030. Is that achievable given what you're seeing on the ground and these results that you're seeing from hospitals?
Well, Justice, that was a resolution passed in Melbourne at the International AIDS Conference, where they said by 2030 we must have brought down an end to HIV/AIDS, and they define what that means. It's defined in what they call 90-90-90. That means when we could stand up and proclaim that we've brought an end to HIV/AIDS only if 90% of populations know their status at any one time, and that 90% of those who are positive are actually put on treatment. And then 90% of those who are on treatment are virally suppressed. That means they are still HIV positive, but they are not transmitting the virus because it's suppressed in their bodies through treatment. Once we reach that stage, then the world believe we can proclaim that, look, we have brought an end to HIV and AIDS. And we think that is achievable if we can work hard enough.
Do you think, though, the fact that there have been these successes that everyone is talking about, that yourself are pointing out, that we're becoming a little bit complacent that, HIV and AIDS is no longer a problem, and so we're falling back on the practices of the past, no usage of condoms and so forth? Is that why we saw a spike in infections, for example?
It's possible, Justice, but I think people over-exaggerate it. If you read literature from experts who are realistic, treatment of HIV/AIDS is easier than prevention. Prevention is the best, but it's human behavior, Justice. Changing somebody's behavior at the mass scale is a very, very difficult thing. What am I trying to say? The easiest way to spread HIV and AIDS is to distribute condoms along on a very wide scale, or to start with, let's go back to the ABC, to abstain. Abstain, be faithful, condomize. For how long have we been teaching that? 30 years, 30 full years. There is no way anybody will say they don't know about it. But it means they must change their behavior completely. Now, that is very difficult. But if you give them treatment, they found it, it's just human behavior, and I'm not trying to justify anything. For instance, at the time when they said prevention has gone down, the use of condoms, I'm sure you are quoting the study from the Human Science Research Council. During that same period, we have actually doubled the number of condoms that the state was distributing. We doubled them. The female condoms, we did not even double them. I think we increased them about 3 times. That was the time at which condom use seems to have been getting very low. So we are saying, because treatment is also prevention, we must also not undermine that. For instance, the fact that we are no longer having 70,000 children born HIV positive, only 7,000. It's because of treatment. In other words, that treatment is preventing babies from being born HIV positive. And that's why in Melbourne, they are saying if we can have 70% of the people who are on treatment being virally suppressed, meaning no longer transmitting the virus, then we'll have arrived. But the best way of achieving that was to give condoms. But giving condoms and having a person to use them are two different things.
And what are your plans in that regard, in that education space? Are you going to continue to increase telling people, spreading the message? Are you going to continue with condom distribution?
Oh yes, we are going to continue because we want to cover all the corners. In fact, we want to issue more adverts about that, but we continue increasing the condom distribution. We are not only doing that, we've even tried to study exactly why do people don't want to use condoms. And we had peer groups, we put peer groups together, especially youngsters. Many of them expressed the problems with the present condom that the state is distributing. They were saying it has got a smell they don't like, and it has got features they don't like. So we have actually procured a new condom which is colorful, with a lot of aroma. We're hoping to attract the young people.
Well, let's hope it works. Yes. But let's look at some of there have been some criticisms of the rollout, for example, of ARVs. The TAC has mentioned that 37% of the people who did take up ARVs were lost in follow-up, that they just fell off the system. They've mentioned that 1 in 5 health facilities have had drug stockouts in the past 3 months of the surveys that they did. That means that people get on the system and fall off.
Let me start with that one of falling off. It's not only the TAC. The TAC is lodging a complaint as an NGO. We have done our own evaluation, and that evaluation is said to be the biggest in the world. We have brought in the World Health Organization, which came with a huge team of people. There were about 81 experts on the ground. They were visiting our districts. They visited half of the districts in South Africa. We've got 52 districts. They visited about 22 of them. And then visited about 100 health facilities. They picked that up. And the reasons are that we don't have a unique patient identifier. We are looking for one. Those people might not be lost from treatment. They might be, but they might not be. They might just have changed the place of abode, like somebody moving from KwaZulu-Natal to Johannesburg, which happens all the time. Or from my home province of Limpopo, where I know many people are trekking this way. If they were getting treatment in Limpopo, when they come here, they might actually register in another clinic to get treatment, but we are not able to follow them up. So we are busy with that unique patient identifier.
What about the drug stockouts, though?
Yes, Justice. That's a reality. The people were saying we are in denial about the fact that there is drug stockouts, and we are denying the fact that there's a crisis. And I was saying there is actually no crisis. It's a logistical problem we're having, Justice.
But it's a logistical problem that has a massive impact. If I'm on ARVs and I can't get them because my local clinic has run out, there is a big problem because I can't continue my treatment.
Well, time and again, clinics will run out. The question is, when it ran out of stocks, for how long and what? Because some of the reports we read is as if the whole country is dark, there's no ARVs. Let me explain to you. We have got a company, Justice, that is keeping 10% of all the ARVs in stock. We call that the buffer stock. We don't touch it. It's waiting for a real crisis. When there are no more ARVs anywhere, we release that buffer stock. If we have not yet released it, then we can't call that a crisis. What you experience is maybe a period of 1 day or a few hours where the clinic ran out, because there were more people coming in.
But there are adverse medical consequences to that.
Of course, they are, Justice. They definitely are, and we are aware of that. But Justice, if you are running 30%, no, actually more. South Africa is running more than 30% of the global program of HIV and AIDS. More than 30%. It means logistical problems. The problem is so massive that it has to have this inherent problem. So we are looking for solutions. For instance, Some of the solutions we are looking for is that the bigger hospitals should not depend on the present and normal logistical supply. They must be allowed to order directly, because then they'll know when they are running out of stock instead of waiting for the depots and all that, you know.
Okay, Minister, I'm going to stop you there. We're going to come back to the issue after the break. Stay with us as we continue our conversation with Minister of Health, Dr. Aaron Motsoaledi.